Muscle loss doesn't announce itself. It doesn't arrive with a diagnosis, it doesn't show up clearly on the scale, and it doesn't feel dramatic at first. For a long time, it feels like nothing is happening at all. That's what makes it dangerous. When muscle disappears, the body changes in ways that are subtle at first, but deeply consequential over time. Those changes affect balance, injury risk, recovery, metabolism, and long-term resilience, often long before anyone consciously connects the dots back to muscle. One of the earliest systems affected by muscle loss is stability. Muscle is not just about producing movement, it is constantly providing control. It stabilizes joints, manages posture, and performs continuous micro-adjustments to keep the body upright and coordinated. This happens unconsciously, thousands of times per day. When muscle mass declines, those corrections become slower and weaker. Balance becomes less automatic. Movements that once required no thought begin to require attention. This is why fall risk increases even in people who don't feel weak or frail. It isn't that they suddenly become careless. It's that the muscular reserve required to correct small disturbances is no longer there. A slight slip, a misstep, a quick change in direction. These events require rapid muscular responses. When muscle disappears, those responses are delayed or insufficient. Muscle also plays a critical role in absorbing force. When muscle is present, it acts as a shock absorber. It spreads load across tissue and reduces stress on joints, bones, and connective tissue. This protection becomes especially important during unexpected movements. As muscle disappears, that force has to go somewhere else. Load shifts to cartilage, ligaments, tendons, and bone, structures that were never designed to absorb repeated impact on their own. Over time, this increases wear, pain, and injury risk even during routine activities. Minor incidents that once would have been inconsequential become meaningful injuries. A stumble becomes a sprain. A missed step becomes a fracture. A minor strain becomes a chronic limitation. Recovery is another major casualty of muscle loss. Muscle functions as a metabolic and functional reserve. During illness, injury, or periods of inactivity, the body breaks down muscle tissue to supply amino acids for immune function and tissue repair. People with more muscle can tolerate that temporary loss. People with less muscle cannot. When muscle reserve is low, even short periods of inactivity lead to rapid declines in strength and function. Regaining lost capacity becomes slow and difficult, and in some cases, incomplete. This is why muscle mass strongly predicts outcomes after hospitalization. It predicts how well someone tolerates surgery. It predicts how quickly they regain independence. It predicts whether they return to baseline or permanently lose function. Age alone does not explain these outcomes. Muscle does. Metabolism also changes in ways that compound the problem. Muscle is metabolically active tissue. It contributes meaningfully to resting energy expenditure. When muscle disappears, basal energy needs decline. At the same time, glucose handling worsens. Insulin sensitivity declines. Fat gain becomes easier even when calorie intake remains unchanged. People respond in a way that feels logical. They eat less to control weight. But this response worsens protein shortfalls, accelerates muscle loss, and further reduces metabolic capacity. The cycle feeds itself. Less muscle lowers metabolism. Lower metabolism encourages restriction. Restriction reduces protein intake. Lower protein accelerates muscle loss. Throughout this process, body weight often remains stable. That's what makes muscle loss so deceptive. The scale does not distinguish between muscle and fat. Someone can maintain the same body weight for years while losing muscle and gaining fat underneath. Strength, however, tells the truth. Tasks that once felt effortless begin to require effort. Recovery takes longer. Fatigue accumulates. Tolerance for physical stress shrinks. Most people interpret this as normal aging, but much of it is not inevitable. Protein plays a central role in slowing muscle loss. Adequate protein supports tissue repair. It preserves muscle during periods of stress. It amplifies the adaptive response to resistance training. Without adequate protein, even good exercise habits produce diminishing returns. Muscle breakdown slowly outpaces rebuilding. This process does not cause sudden collapse. It causes gradual erosion. That erosion continues quietly until everyday tasks feel difficult instead of automatic. The goal is not to maximize muscle size. The goal is to maintain buffer. Buffer allows mistakes without consequence. Buffer absorbs stress. Buffer protects independence. Muscle provides that buffer. Protein helps preserve it. Once muscle is lost, rebuilding it is possible, but it is far harder than preserving it in the first place. It requires time, effort, and consistent stimulus that many people are not prepared to provide once decline has already occurred. That's why early, consistent protein intake matters long before loss feels obvious. Muscle loss affects far more than appearance. It reshapes how the body moves, how it responds to stress, and how resilient it remains over decades. This is not about aesthetics. It is about function. This is Protein Truth.